This is an assessment of spondylolisthesis. History questions you'll want to ask the patient are, what happened? And they won't necessarily be able to give you a mechanism of injury with this, but the mechanism of injury for this is a repeated lumbar extension. Next question you'll want to ask is what type of pain they are having, and they'll have achy, possibly constant pain. Where is the pain located? Would be the low back, the buttocks, the posterior lateral thigh. What sport do they play? This injury happens most often in young females and has a higher likelihood in sports like gymnastics and cheer. How long has it been hurting? The pain will be chronic, so it can have varying amounts of times, but it'll be over a long period of time. What makes the pain worse? They'll answer reaching overhead, trunk extension, and standing for long periods of time. You'll want to ask them what makes it better, and often the answer is rest. And other history questions you'll want to ask are if they have any history of injuries, any recent increase in their training intensity, and you'll also want to ask if they have any numbness or tingling to rule out nerve pathology. To start off our assessment, we are first going to look at posture. We're looking for lumbar lordosis. Often they will also have thoracic kyphosis. We're also looking for an anterior pelvic tilt, and they may have flat buttocks. We're first going to test their range of motion, so I'm going to have my patient bend down to touch the floor. They may have limited range of motion with this, but they should not have pain. This is a good opportunity to go ahead and palpate the spinous processes. We're going to start in the lumbar region. And what we're looking for is a step off, which will usually be found between L4 and L5, or L5 and S1. Going to have the patient stand back up and then come into extension. And go ahead and stand back up. They're going to have pain coming back up from flexion into extension, and they may feel a catching in the process. The 4 tests that we will do today will be the stork stance to rule in our pathology, the Valsalva maneuver to rule out nerve root impingement, the straight leg raise to rule out disc herniation, and the cluster of 4 tests for SI joint dysfunction. We are going to start with the stork stance. Since our patient is already standing up, I'm going to have her place her feet about hip width apart and put her weight on them evenly. Now I'm going to stand behind her to make sure she doesn't fall over. I'm going to have her raise her knee up towards her chest on one leg with her hands on her hips. She is going to extend her back. Positive sign for this would be pain. We are going to test both sides. It is possible that the patient can have pain on one side or both sides. I'm then going to have my patient sit down. Next, I will have my patient perform the Valsalva maneuver to check for nerve root impingement. Positive signs for this test are recurrence of symptoms or pain. I'm going to have her mock doing a bowel movement. Some people don't feel comfortable with this, so you can also tell your patient to pretend to blow like they're blowing up a balloon. I am then going to have my patient lay down on the table. We are going to do the straight leg raise. I am looking for pain or reoccurrence of symptoms. This is checking for a herniated disc. It can also check for sciatic nerve pain pathologies. I will keep my patient's leg straight and passively raise their leg. If they have pain on the side that I am testing, it's sciatic nerve. If they have pain before I reach 70 degrees of flexion can also be a herniated disc. If they have pain on the opposite side of the leg I'm testing, it's also a herniated disc. From this position, I can then start my sciatic nerve cluster. I'm going to do 3 of the 4 maneuvers because for a positive test, you need to have 2 out of 4. The thigh thrust can be a bit uncomfortable for patients, so I'm going to show you 3. The first one is SI compression. To do this, you are wanting to place your hands on either side of the ASIS, and you are actually going to move your hands apart. Positive sign is pain. To do distraction for the SI, you're going to keep your hands in the same place, but you are going to squeeze them together. Pain is also another positive sign. I am now going to have my patient go ahead and flip over onto her stomach so that she's lying prone. And from here I can do the sacral thrust, placing your hand on the sacrum, and then you're going to apply pressure.
Ow.
Positive sign is pain. From here we're going to test for the strength of the trunk extensor. So I'm going to have my patient place her hands on top of her head. She's going to lift her chest off the table, and then I'm going to anchor at her pelvis, and I'm going to push down on her shoulders. Go ahead. Okay, relax. For Spondy, you will see a decrease in strength, and you will also get a positive sign of pain. If you get a positive assessment for spondylolisthesis, you need to refer your athlete to a physician for imaging so that we can determine the grade